delivery of work and our delivery to the patient is the best and at topmost. So this evening, I want to welcome our speaker, Mr. Hezron Ouko. Mr. Hezron is a clinical laboratory profession. He has several titles on him, and he's a learned man. He has done a course on clinical laboratory leadership and management from the University of Washington. He has an MSc in health systems management from Amref International University, and a BSc, Bachelor of Science, Medical Laboratory Sciences from JKUAT. And currently, he works at MSI as Reproductive Choices Kenya. So I would want us to take this opportunity to welcome our speaker this evening. Kindly, with a clap of hands, shower him with the flowers, and let's welcome Hezron to take the stage as he takes us through from risk to readiness, enhancing safety in the clinical laboratory. Kindly welcome Hezron. Thank you for those claps. Thank you for the flowers you are showering Hezron with. I would like to take this opportunity to hand over the mic to you, Hezron. Karibu sana.
Asante sana, Nelly. I hope you can hear me.
Loud and clear, loud and clear.
Oh, nice. I'm glad to be here again to present on this important topic of safety. And every day as we come to the job or as we leave our houses in the morning, they normally say that leaving the house, you must, but returning is a chance. It is not guaranteed that when you leave the house in the morning, you will return safely in the evening. And that is true, particularly for anybody who works away from their homes. And it is even true for any other person who works elsewhere. And for us as medical laboratory officers, that statement is, we can resonate with it very well because we know where we work in. There are a lot of dangers that are everywhere, be it on the road, in the laboratories that we work in. We are exposed every day to different risks that we have to know how to take care of them so that we can be safe every time. It is normally said that before you work anywhere or before you address any problem, you should ensure that your safety is guaranteed first before you look at the safety of other people or even the safety of the things that you work with, like equipment, machines, or even the reagents. So our topic today is just going to help us to know how we can ensure that these safety procedures are put in place so that even as we work in the laboratories or even the clinics where we work in, we are always safe and we can return home safely to our families. Ladies and gentlemen, normally when you get onto a plane to wherever you are going to, you are normally very comfortable and you are seated there. You know very well that if something goes wrong, there's a gentleman in front or there's a woman in front there who is prepared and will take you out of any danger that may come as you travel to your destination. The same happens when you live in the house and you are using a matatu, you're using a bus. You are very sure, or you are always convinced that the person who is behind the steering wheel is someone who will not put you through danger, and also this person will ensure that they protect you when there is any danger that can occur. So the same has to happen for our laboratories. We have to ensure that we as laboratory officers are able to put ourselves outside danger, and also we are able to prevent any danger that may happen in the laboratory. So our topic today is broad, and I've just chosen a few points that we need to know as lab officers. So throughout this topic, we'll be able to learn and understand biosafety in the clinical laboratory. We are also going to be able to understand the biosafety management and the procedures that are done to manage biosafety in the lab. There is a model that I will bring forth today, and this model is called the AMP model, or the framework that has been put in place by one, the WHO and other safety organizations to ensure that safety in the laboratory is maintained and safety is also upheld every day. We will also look at how we can prevent risk, what we do daily to prevent risk, or even what to do to ensure that those risks, when they occur, they are able to be mitigated and then prevented from occurring again. Then we will also look at the safety requirement, the basic safety requirement where you are working in a lab. And then finally, we will look at the role of a manager in a laboratory in ensuring that a safety culture is fostered and a safety culture is maintained in our laboratories. So the laboratories we're going to talk about here are not only clinical laboratories. Although I know that most of our members here, or those who are listening today, most of them work in the clinical laboratories, but these biosafety measures that we're going to talk about today are going to focus on labs, or whatever lab that you work in, be it a research lab, be it a clinical lab, as most of us are working in clinical laboratories, or even if you're not working in a lab, but you work in a place where you are dealing with things which are contagious, or we call them pathogens. You're dealing with pathogens and also the equipment that may put your life at risk when you're using them. So we are not only going to focus on the clinical lab aspect of it, but also other laboratories where our colleagues who are MLS professionals work in. So as we have said that the lab environment has a lot of risk, and this risk come from various sources. This risk can come from the chemicals that we use. The chemicals which are used as reagent can pose risks and dangers to our people. The processes that we use, that we follow in the laboratory also can lead to risks. Also, the specimen that we handle, these specimens, some of them contain microorganisms that can infect us because they are taken from patients who are already sick. And these specimens also pose some danger to us. Again, another thing that can pose danger to us are the equipments that we use, because you can get injury from the equipment if you are not using them properly. So we are supposed to be able to know the safety protocols and programs that have been put in place by different bodies, or even as the national level, what safety protocols have been put in place to protect people who are working with infectious agents or who are working with pathogens. And also we are supposed to know the designs that should be taken in place when we are designing a laboratory, so that we are not just looking at the laboratory as a building or as a space where tests are taking place or tests are done. And this brings us to something called the design of the lab. The design of the lab is not there to bring about the beauty or aesthetics part of it, but the whole design of the lab brings with it the safety, because those designs are supposed to be made in a way that it makes people who are working there safe. It makes the equipment which are used in that lab safe. And also it ensures that everything that is kept inside that laboratory is also safe from people who may want to steal them or people who may want to mismanage them. Again, the design of those labs is also made in a way that it does not pose any danger to the population of the community. So the public have to be sure that the lab will not pose any risks to them by allowing pathogens or infectious agents to go into the public and infect them. Again, also the public has to be sure that these laboratories are going to be able to detect these pathogens or infectious agents early enough, so that measures can be put in place to deal with the pathogens when they occur. So managers normally have a very big role in organizing and maintaining safety standards in the lab. But every other person who works in the laboratory has a role to play when it comes to safety. Safety is for everyone, but now the managers normally have the biggest role to play, because when anything goes wrong, they are the people who are supposed to be answerable, and they are the people who are supposed to be knowing why that thing went wrong and how it's supposed to be addressed. So I'm going to be using terms here, which I'm going to be using interchangeably. They do not mean the same thing, but in our everyday practice, we normally interchange them. And I will just explain these terms so that when I use them, you are able to know what we are talking about or what we are referring to. So one of the things that I will be talking about a lot is the biorisks. And we find that biorisks are risks which are associated with the biological material in the laboratory. So these materials may include things like specimens. They also include things like the samples that we take from the patients. So specimen can be blood, it can be stool, it can be urine. So all these things are biological materials which can pose risk to the people who are handling them and the people around the people who are handling these things, or even the public at large. And these are what we call the biorisks. They are everything that are biological, which are associated with the laboratory. They may be the things which are used daily in the laboratory, as you know. Again, we also have something called the biosafety management. So biosafety management, these are containment principles, technologies, and practices which are implemented to prevent unintentional exposure to the people who are working with biological materials. So if you're putting principles and technologies in place to prevent people from getting exposed or from getting infected by the biological materials they're using, we call that biosafety management. That type of management is called biosafety management. And in a way that we can remember it, we say that biosafety management ensures that we protect the people who are working from the pathogen. We are protecting them from the pathogen so that the pathogens do not infect them. And then we have another term called the biosecurity. And biosecurity, these are the protection, control, and accountability for valuable biological materials which we use in the laboratory. So these materials normally require us to protect them and control them, in that we're protecting them not to leave a particular area of the lab, or even not to leave a particular surface in the lab where they're used, so that they can go outside and infect the people who are using them, or they can go into a larger community. And this, now we talk about control. How do we control these biological materials that are used in the lab so that they do not go to the population and infect the people who are outside the laboratory? So if you talk about biosecurity, we're going to be looking at the protection, we're going to be looking at the control and accountability for valuable biological materials. So in another simple term, normally if you talk about biosecurity, we say that we are trying to protect the pathogen from the people. So that interaction between the pathogen and the people is avoided at all times. And then lastly, we are going to talk about the biorisk management. And the biorisk management are practices of biosafety and biosecurity combined. So these things here may have different other definitions, but for this particular presentation, I would like us to use the definitions I've given on your screens. I'll be using some of the words like biorisk management and biosafety management interchangeably, but now you have understood that these two terms are different and they do not mean the same thing. So ladies and gentlemen, when we are talking about the biorisk management, we are trying to manage these risks so that these risks do not affect us as laboratory officers, and they do not also affect the people who are around us or even the patients that we are serving in the laboratories. And here we are going to introduce a model called the AMP model. This AMP model is a model that was instituted by the World Health Organization, and it has been accepted to be a very good way of dealing with the risks that occur in the laboratory. So the AMP model, the A in the AMP model means A is assessment, and then M is mitigation, and then P is the performance. So this model wants us to assess risk, be able to assess the risk which may likely occur in the laboratories. After assessing these risks, the model also wants us to mitigate, give what we think is going to be the corrective action for these risks that may occur in the laboratory. And then lastly, performance. Performance now will be checking if the things we put in place as mitigation measures are actually working. You may call the performance part of this as an audit, or even checking if the things you're putting in place to work with the biorisks that are available are working. So as you can see there, biorisk management equals assessment, mitigation, and performance. So when we look at this I'm going to look at each of these independently and try to describe what each of them entails and how we can do it. So if you look at assessment, you are supposed to be able to assess risks which are likely to occur in the laboratory. So biorisk assessment is simply means how do you identify these risks and how do you grade these risks from what is, let's say, medium risk, what we say is high risk, and what we call the low risk. So during assessment, you are supposed to be able to identify the risks which are likely to occur, and then you should also be able to grade this risk from low risk, medium risk, and the high risks. So during the process of assessment, you are identifying the hazards and evaluating the risk associated with the biological agents and toxins. You should also take into account the adequacy of existing controls and decide whether or not the risks are acceptable or not. So during the assessment, identify the hazard. After identification of the hazard, review the laboratory procedures for dealing with the hazard, if at all there is a procedure for dealing with that particular hazard you have identified. And then also research more about that hazard. If you are not well acquainted with the hazard that you think may occur in the laboratory, you need to do some little research about the hazard that is likely to occur. This research that is normally done in the laboratory, you do it among your peers or even the people you're working with by simply asking them questions, what they think is likely to pose a risk in that lab. You may give them surveys, or you can just do oral questionnaires where you ask them what they think, and then they will tell you those things. As a safety manager, whereby the safety manager in small laboratories may be the manager of that lab, you will be taking their opinions and then recording them. Then from that data you have collected, you are supposed to sit down and grade the risks that they have told you, and then see how they can be mitigated. So during the assessment period, as I've mentioned, you identify the hazard and then assess that hazard and then quantify it according to the levels, the 3 levels I've mentioned. Then after quantification, you choose the control that reduces the risks. And after choosing a control that reduces that risk, you are supposed to put in the control into practice it. And then after practicing it, you evaluate whether the controls are effective. By evaluating whether these controls are effective, you are simply looking at whether these controls you have put in place, are they working? So as we know, biorisk assessment is an analytical procedure, and biorisk assessment is normally designed to characterize biological risk in a facility or within a laboratory unit or other type of operation dealing with the potential pathogens or even samples. So after assessing these risks, we are supposed to do what is called risk mitigation. So under the risk mitigation is where now you try to look for solutions to solve this risk. I want to give you a very simple example of a risk that may occur daily in the laboratory and how you can mitigate it, and then how you can also assess that performance of risk. For example, you have the risk of people getting infections due to the fact that PPEs are not provided for your laboratory for the people to work with. So here, during the assessment of a risk in this situation where PPEs are not provided for laboratory officers to work with, you are assessing that risk. You are going to be saying that they are missing PPEs for laboratory officers to work with. That is assessment. The statement from assessment will state like that. And then mitigation. What can you do to address this? So simply we'll say that PPEs are supposed to be provided appropriately, because some of the PPEs which are needed for, let's say, the front lab are not needed when you're working with the high-risk pathogens inside the lab. So you're supposed to be mitigating this by providing PPEs appropriately for the laboratory officers to work with. That is the part of mitigation. And then performance. How will you know that this provision you have made for the PPEs, whether it is working? So there you will do what is called audits after that to see whether the infection rates have reduced in the labs, or even accidents of people getting in touch with the samples or even the pathogens has reduced. So that is what you do during mitigation. Mitigation, you look for a solution for that particular problem. And then the P, which is for the performance, you are supposed to be able to audit that mitigation that you put in place, whether it is working properly. So most of the time when you're doing performance evaluation, you want to check what you had initially before assessment of that risk, and then now what you have now. If there's a difference, whereby that difference is a positive one, the things which used to happen negatively before are now not happening, then now you can give yourself a thumbs up and say that the mitigation measures you put in place are actually working. And on your screen, you can see that we have hierarchy of control when you are having these risks. We have risk, which if you identify them, you are supposed to physically remove them from the area where they are. So those risks are the ones which are the high risk. So you eliminate them totally, you remove them from that area so that people cannot get into contact with them. And then there are also risks which if you see them, you can replace that hazard. By replacing it, you remove it and put something else in its place, which can be used. If it is a chemical you're using in the lab that is toxic, then you can replace that toxic substance with another thing that is not toxic. That is called substitution. You substitute the hazard. Then we also have what is called the engineering controls. Under the engineering controls here, you are trying to isolate people from these hazards. So engineering controls include things like, for example, if you're having a lab, you can put biometrics so that people who are getting inside the lab are people who are allowed to go to that lab, and they should be using their own biometrics to get inside the lab. They can also be using cards to get inside those labs. All these are called engineering controls. Another engineering control that you can be using is things like you must have a door for places which you don't want people to go into frequently. And then after having these engineering controls in place, you will have to have what is called the administrative controls. Administrative controls here, you change the way people work. And there are a lot of things you can do during the administrative controls. They include things like labeling areas properly so that you can see on a door there, it is indicated that there is no admitting of people or who are not working in this place. So those signages where it only shows that people who are admitted in the laboratory and people who are working inside there, or even the staff who work in that clinic are supposed to be admitted there. Those are administrative controls. And also administrative controls also may include things like policies you are put in place for people to work with. For example, if you have policies of how you manage your wastes, that policy is an administrative control that is used to change how you work so that you can be safe from these hazards. And then the last one here, we have the PPEs. So PPEs, as we know, they protect the worker with personal, with the worker, it protects you from getting into contact with the pathogen. So they include things like dust coats, they include things like gloves, they include things like goggles. If you're working in a place where you can get splashes and things can get into your eye, you will need goggles. You will also need masks sometimes to protect you from inhaling fumes that are toxic when you're working with them in the laboratory. So as a manager or the manager in charge of safety, as a safety manager, you are supposed to ensure that your people, the people you work with understand all these things. And then after understanding them, you ensure that they are putting these things in practice. Ladies and gentlemen, if we fail to work on risk management in the laboratories, there could be many things that will happen in your laboratory if you're not tackling this safety. If you're not having safety procedures in the lab, the things which may happen are a lot. And some of them we picked here include the loss of reputation. So a lab may lose reputation because most of the time people get injuries in that lab, or people are getting infections when they go to that lab, or people really don't want to be there because in that lab, the people, the person in charge is not providing PPEs. They are not putting in place the measures which are supposed to protect the people and also protect the workers who are working there. So you're going to lose reputation. And reputation is one thing that if you lose, it is very difficult to regain your former self after losing reputation. As you know very well that there are facilities which were very good previously, but something happened. Something somehow happened, and then they lost their reputation because of that thing that happened. It has been difficult for them to go back to where they were initially. So if you neglect the safety, the safety of the people working for you, the people who are coming to the laboratory, and even the community where you work in, then you risk losing your reputation as a lab. You may also lose customers, and when you lose customers, the customers will go away with the money. So you will lose customer, and also the income will go down because customers are not coming to your laboratory. And another thing that you may have is a negative effect on staff retention, because staff do not want to work in a place where their safety is not guaranteed, or even if they are being paid well, but the safety is not guaranteed, they will most likely leave that place and go. And then lastly, there will be increased cost associated with the possible litigation insurance, because when people get injured, you sometimes will find yourself in court with them, seeking compensation for the injuries they got while working for you. So we are supposed to ensure that we put safety measures in place so that these things do not affect our laboratories. We also have, as I said, that managers have a very big role when it comes to safety in the laboratory. As much as everyone has a role to play when it comes to safety, managers always bear the biggest role when it comes to safety. So manager has a role to play here. They are supposed to be able to develop basic rules of safety and ensure that staff are trained on safety. This training should happen regularly, and also there should be refresher training after every year so that the staff can be well acquainted with safety procedures which are there or which have been put in place by the laboratories. So a manager also should know the basic biosafety issues when working with chemicals or pathogens, because it is you who is supposed to be telling the other people what to do when they're working with toxic pathogens, or when you're working with toxic chemicals. So you as a manager need to know these biosafety protocols when you're working with these pathogens. Also, you need to understand how to perform an extensive risk assessment in the laboratory, because if you don't know how to assess risks, you will not be aware of them. And if you're not aware of these risks, which means that they will happen without you noticing. And the moment they happen without you noticing and you're not aware of them, they will affect you badly in the long run. Also, as a manager, you must be able to conduct laboratory safety audits to ensure that if there was a risk that you identified previously, this risk has been taken care of, and then it has been prevented from occurring again in the lab. During the safety audits, you're supposed to also ensure that all the other staff also do their audits in their capacity in the areas where they work. They do audits and then they give you reports. These reports are supposed to be compiled and put in a file for reference in the future. And then take note of whatever happens in the laboratory. You should be recording everything that happens in the laboratory, because it is from what happens in the laboratory that will help you do audits. When you're doing audits, you want to take data from the past and then the recent data, and then you compare them. But if you don't have the data from the past because you're not doing records, you'll not be able to do a good audit. So how is the design and safety management program happening? How do we design the safety management program in the lab? I mentioned previously, let me just mention it before I continue this slide, that the laboratory as it is not for aesthetics or even for beauty. The way you see those windows are large and you're forced to open them and keep them open all the time. It is not because they want those windows to be open. It is supposed to be open so that the circulation of air can happen properly in the lab. So if you see things like the space, other spaces which are just left without anything in them, don't think that those people are stupid by wasting that space by not putting another thing inside there, or even finding a proper place to store things like reagents, or even things like chemicals. I don't think that you can just put them anywhere. So the design of that laboratory, the way it is designed in a way that it is able to ensure that people are kept away as possible from pathogens and the hazards that may occur in that lab. So when you're designing the safety management program, you're supposed to develop a manual with procedures for biosafety in the laboratory. This manual with procedures, you can borrow it from other people who have made them. If you don't have one, you can develop a manual on your own that serves your lab, because every lab is unique. So develop a manual with procedures for biosafety in your laboratories. And then also organize biosafety or biosecurity training exercises, which cover precautions, what they're supposed to know about the precautions, and also covers infection prevention control measures which they can put in place to prevent them from these risks. Also, those trainings should cover chemicals, how they are supposed to be handling chemicals, and how they are supposed to be storing those chemicals to prevent them from injury. And also radiation safety. They should know about the radiation safety in the laboratory, because there are places in the laboratories where there's radiation. For example, if you have a UV area in the lab, a UV room, people are supposed to know how to deal with that room when they go inside there, or even how they are supposed to work in that particular room where there's radiation exposure. And then they should know about the PPEs and how to use them properly, because PPE will only work if used properly. If you're not using PPEs properly, then they may not work for you. For example, there's a very simple analogy that somebody brought in place. Somebody said that, why are you protecting yourself in the laboratory, but not protecting others by simply going into areas which are referred to as common areas or clean areas with dust coats you have been with in the lab? You are in the lab analyzing samples for TB, and then after finishing immediately, you leave and go to the kitchen with that lab coat, the same lab coat, then go and sit in the kitchen there for 30 minutes, run back to the lab again when you're called to, with the same lab coat, go and analyze another sample for let's say somebody who is suspected to be having cholera. Then after you have been done with that, you run again to a common room, or even the kitchen, or even a clean area with the same lab coat. This also affects people who walk outside the facilities where they work in with the same dust coats, or even with the same scrubs they work with in the hospitals, and then go to the matatus with them. You are exposing people, you are exposing other people, and you may cause injury to them. So you are supposed to know that these are PPEs. These PPEs are about preventing people from getting infected with these pathogens. And how am I supposed to be using these PPEs properly so that they cannot expose other people to danger? So PPEs are supposed to be used properly to help you. Even the way you are using your gloves sometimes is wrong. So you need to know as a manager that these people must be taught how to use these PPEs in the correct way. If you're wearing a mask, that mask should be covering the place it should be covering, not you wearing the mask around your chin or pushing it somewhere around your forehead. Or if you have goggles, your goggles are constantly on your forehead and not covering your eyes. They're supposed to protect you in the laboratory. Also, your staff should be able to know how to deal with hazardous waste and how to dispose them. So disposal of waste sometimes become tricky, because you find that you're a small laboratory which has not had any MOU with any company that is disposing waste, and you're generating a lot of waste every day, and it is difficult for you to dispose them. So what you do, you are simply going to put that waste in the general waste category, and when the people come to pick them, they go with them unknowingly. So you are exposing these people, and these people, when they're exposed, they can go outside there and also expose other people, and it can become a continuous circle, which infects other people with a very hazardous material. So ensure that people know how to dispose waste properly and how to deal with hazardous waste before even they are being disposed. Also, you should be able to know how to deal with emergencies in the lab. So as a manager, teach your people how to deal with emergencies. For example, a needle stick, if a needle stick happens in the lab, what is the protocol for that? I know everyone knows about the PEP protocol, and it's supposed to be there as part of your manual. In your manual, but a safety manual is supposed to be there, the PEP protocol. Sometimes you may even be required to print it and put it on the wall for people to know if they are pricked, for instance, what should they do? Because if you have people who do not know what to do when they have a needle stick, they will begin washing and even sucking blood from that area where they have been pricked, or doing very funny things, because you've not taught them how to deal with emergencies. So these emergencies include the needle sticks, include cuttings, which may happen from maybe glass containers or even from burns from chemicals. What happens if somebody's been burnt by a chemical? So you need to tell them that these things they happen, and this is the protocol that is followed if such an emergency happens. And as a manager, also establish a process to conduct risk assessment. This process for you to conduct a risk assessment should not only be understood by the manager, but it should be understood by every other person in the laboratory. But you are the one who is in charge in conducting this risk assessment. And then finally, as a manager, as we said, you are supposed to go and sit down with all that data, analyze it, and see if your mitigation measures are working properly. And that is done by simply doing what is called audits. So we have the basic requirement for biosafety in the laboratory. One of the things that you are supposed to know, I've mentioned this a lot, the personal protective equipment. The personal protective equipment are numerous and they have different functions. Sometimes you may find that you're working with a very infectious agent. If you're in a lab where you're working with infectious agents, then your manager should be providing with disposable PPEs, not PPEs that you wear and then come the following day and wear them. If the agent you're working with is infectious, ensure that you are having disposable PPEs which can be used once and then disposed of immediately. And also, I know most of the labs do not have things like goggles. They don't have things like masks which people wear when they are working. But there are places when you are working in, you are at risk of getting exposed to toxic fumes or even toxic gases. In such areas, you will need to have these things which are going to protect you from inhaling these things. Apart from having this protective equipment, you can also have a design in a way that you are out of danger all the time. And this will also require you to have things like a biosafety cabinet when you're working in the laboratory. As you know that in a lab where you're working with people where you're working with the agents which can infect people, you are expected to have a biosafety cabinet so to protect the people, so that people perform tests inside and then the air inside is controlled such that it does not come outside and then affect the people who are working there. So you need, as a basic thing, you need personal protective equipment. For a small lab, you must have gloves in enough quantities. Not that people are sharing gloves and people are putting gloves in their pockets. And I've worked in places where I've been told to use 3 gloves the whole day. And the person was confidently telling me that if you're not soiling them, you can just remove them slowly, put them there and use them again on the next patient. That was wrong. Obviously. So have these things in enough quantity so that your clients, your workers can enjoy working in the laboratory. Because if you are restricting them from using them, they will be doing things which are not allowed or which are outside the framework of our job. And then you're supposed to have the fire extinguishers and fire blankets. So fire blankets are supposed to be in the lab as well as in the kitchen where there are risks of having fires. And just don't have the fire extinguishers on the wall pinned there. Teach the people on how to use the fire extinguishers or even how to use the fire blankets. I know most of us do not know how to use the fire extinguishers because we have not been taught. We see them on the wall there, but the manager has not told us how to use it. We don't know that we are supposed to be, which area of the fire are we supposed to be directing the nozzle of that fire extinguishers to. And if there's a fire in a place where there's no extinguisher, but there's a fire blanket, what are we supposed to do with that blanket? So you're supposed to tell your people and train them properly that in this area, there are risks of fire coming out. And if that happens, you are supposed to use this fire extinguisher to try and put out the fire. And this is how you use it so that people do not run outside and leave the area without trying to put out the fire. But you also know that when such a thing happens, ensure that you are safe first before trying to save anything else. After assessing the area and ensuring that you are safe, that is when you can see whether you can reach the fire extinguisher and then use it to put out the fire. And also, you're supposed to be having appropriate storage cabinets for flammable and toxic chemicals. So toxic chemicals are supposed to be stored safely because these things are toxic, and when they come into contact with people, if you have acids in the lab, those acids are supposed to be stored in a place where they cannot easily fall off and injure people, because they can cause catastrophic accidents in the laboratory. So have a storage area or cabinet for flammable and toxic chemicals. And after having the storage area for flammable and toxic chemicals, ensure that that area is labeled so that anybody who is coming in the lab can be able to see that this area contains flammable and toxic chemicals. Have eye washers and emergency showers in the lab so that if somebody has an accident, they can easily wash their eyes. They can also easily run to the shower and take an emergency shower inside there. Have a waste disposal supplies or equipment. For example, you're supposed to be having the bin liners, not just people putting the contaminated things or gloves inside the bin without having a bin liner. If you have a bin liner, it is easy for you to remove the bin liner as a whole and leave the bin there. So have these supplies in enough quantities in your laboratory, because those bin liners are supposed to be for single use. After it is full, you're supposed to fold it and then put it in the area where the people who are supposed to be collecting waste should find them. Don't be there cleaning inside the bin liner and then you want to reuse it again. It is there for convenience so that you can easily remove it from the bin and then dispose it in a place where it is appropriate. And also, you are supposed to be having a first aid kit and equipment in your laboratory so that people can quickly offer first aid to others when they get injured. So we have standard safety practices and policies. A standard is something that people have all agreed upon of a way of doing something. So you're supposed to be having standard safety practices and policies in place for your laboratory. For example, limited or restricted access. Not everyone is supposed to be having access to the laboratory, because when people get access to the laboratory, sometimes one of the risks that you are going to put yourself into is theft. People may easily pick things from the lab and go away with them. People can also pick sensitive things. For example, there are people who are working in research labs, and when somebody comes in there, you don't know what they are thinking. They can bring something into the lab or carry something that is dangerous away from the lab and then end up exposing people what else are there with that particular thing. So have limited or restricted access. There are people who are supposed to be given access to the lab. For example, the directors of the lab, the stakeholders, or even your sponsors. But when they come, they're supposed to be wearing PPEs before they get inside the lab. So for them, they can have access. And there are people who also have limited access to the lab. For example, other clinical staff like the nurses, the doctors, the clinicians, they have restricted or limited access to the lab. They're supposed to access the lab only if there are people who are in the lab with them, or after they have told you what they're coming to do in the laboratory. Otherwise, they're supposed to remain outside at the sample logging area, give the sample there, and then go back to their stations. Again, there are people who should only go to the lab if they are given what is called escorted. They are supposed to be escorted to the laboratory, not being left alone to go into the lab. These include people who are working for us to maintain the laboratory. They are supposed to be having escorted access in the laboratory, and they should only work when the laboratory is not working or if it has been closed down. So people who are having escorted access should not be given access any other time when the laboratory is busy. So also you're supposed to be having hand washing before entering and leaving the laboratory. I've mentioned that it is very important to wash your hands before you enter the lab or even before you leave the lab. Before entering the lab is important for those labs which ensure that you don't want to infect the things they're doing there. For example, the research lab. So you need to be very clean. Wash your hands before going in, and before leaving that lab also, you wash your hands. You need to prohibit eating, drinking, smoking, handling contact lenses. If you have contact lenses in your eyes, You are not supposed to be touching them every time while in the lab, or even applying cosmetics like makeup in the work areas, or even when you're in the lab. You have always been told that when in the lab, you're supposed to be having, if you have long hair, you are supposed to wrap it. So that you don't go around dragging people with your dragging things with your hair, because you can contaminate yourself and then contaminate other people also with your hair. So prohibit all these things in the laboratory and make it mandatory that this area is not for eating or even drinking or smoking. Do not handle the contact lens here or apply cosmetic in this area. They should understand that these things are policies and they are standards which everyone must follow in the laboratory. Also prohibit mouth pipetting. I don't know if there are people who are still doing mouth pipetting. We only did it in high school. It doesn't happen because technology has moved so far. But if you are using mouth pipetting, that is highly prohibited because you are putting yourself at risk, and you can get infected with pathogens. Also use biosafety cabinets to prevent aerosols and splashes. I've mentioned that. And then use fume hood to prevent inhalation of vapor or gases. Yes, also storing chemicals properly. So chemicals should be stored in a way that they are not they will not be able to topple off easily or even fall off and then injure people who are working there. And if you have gas cylinders you're working with, you are supposed to secure them by tying them with a chain such that it is not easy for them to explode when they fall down and injure people or even cause fires in the lab. So also, every day when you come, you are supposed to be decontaminating surfaces. There are surfaces which are supposed to be decontaminated daily, and there are surfaces which are supposed to be decontaminated weekly if it is not in a place where you work every day. And also, even the surfaces on the walls are supposed to be clean and free of dusts every time. So ensure that decontamination of the surfaces happens as required. If it is required that the person who is working in that section does the decontamination, ensure that it is only the person working in that section who is doing the decontamination. You are not supposed to bring somebody who is doing the general cleaning areas to come and decontaminate the benches, because they do not know where they are risk and where they are not risk. So they can easily injure themselves or even infect themselves with pathogens. So if you're required to do it as a personnel, just ensure that you do it alone and not involve other people who do not have proper understanding of how those surfaces are decontaminated. Again, implement insect and rodent control in the laboratory and use PPEs, i.e. the masks, gloves, goggles when working in areas where you can have risks of contamination. Also prohibit wearing of sandals and open shoes. That is always very clear in the labs. And in the era of Crocs, people want to wear Crocs even in the laboratory. Crocs are not for you, guys. Ensure that you're wearing closed shoes always when you're working in the laboratory. Then dispose chemicals, biological waste according to laboratory policies and standards put in place. And then lastly, conduct annual safety refresher training and ensure that people who work for you in the lab are aware of these safety standards and principles. So when you are doing what is called administrative controls, I said it also includes labels. You're supposed to label using internationally recognized labels so that people can be able to see that in this place there's a risk of a fire breaking out, so I should not smoke here. In this place, there's a lot of noise, so what should I do? I should be having hearing aid, or they hear their explosive materials. And then when fire breaks out, what should we do? Where's the fire assembly point? And then also label properly where the fire extinguisher is found so that people can help in case of fire. These things, some of them are color coded as you can see there. And I expect that we all know these things. So the intention here is to tell you that you're supposed to be using intentionally recognized labels so that anybody who is coming is able to know what that signage means. Ladies and gentlemen, after tackling all these things, we need to identify how we can know gaps in safety that we have in our laboratories. So we have 6 elements that we need to look at when you're looking at gap analysis. You are supposed to look at the analysis of lab and equipment design, whether there's a gap in the lab and equipment design. You are number 2 supposed to look at the lab and equipment operation, where there's a gap there. And then number 3, you're supposed to look at the laboratory mission and deliverables. And then number 4, you're supposed to look at the lab worker. Is there a gap in the lab worker, the person who is working in the lab? And then number 5, you are supposed to look at the laboratory materials. This includes reagents and consumables or even other agents that we are using. Are there gaps in those areas? And then lastly, number 6, you're supposed to look at the lab and the equipment maintenance. So during the gap analysis, we are going to employ the AMP model in its entirety when you're looking at the gap analysis. So you are supposed to use the AMP model. Think about international, national, county, and facility policies have been put in place during the gap analysis, and then do what is called assessment. So assessment, for example, I said, during the assessment, you have assessed and then you have realized that there's a missing national regulation on equipment control. Then write it down that the gap we have here is a missing regulation and equipment control. Because if you're having a regulation, a lack of regulation and equipment control, which means that any other equipment can enter into your market, and then that will force you to have sometimes equipment which are not standard or equipment which are not working properly. And then you know that if equipment is not working properly, then it definitely will not produce proper results. So during the assessment, ensure that you identify that gap that you have in risk management. So an example I gave there is missing national regulation equipment. I'm not saying that it is lacking in Kenya, but just an example of what you can use during the assessment period. And then so you have seen that there's a gap in equipment regulation at the national level. What should be done? What is the mitigation? What are you proposing that can be done to ensure that that gap is filled? So for example, you can say that have a national regulation on equipment and facility policy on equipment purchase. So if there's a gap at the national level, then you're supposed to talk to people who are concerned to ensure that there are regulations at the national level for equipment control, so that not all equipments can get into our market, or not all substandard equipment can get into our market. Again, if that is not possible at the national level, you as a facility, what are you doing to mitigate that risk? You're supposed to be having a policy on equipment purchase, whereby that equipment, that policy may require you to do what is called pre-purchase inspection, or even have a contract with the person who is going to be selling for you the equipment. Before they go live with their equipment, there's the period that they give you, so that you see that the equipment is working properly. And if it doesn't work properly, you are allowed to take it back during that period, or even if it is broken down in that period, they can come back and correct those errors that are happening. So that is the mitigation part of it. And then performance. So you want to see after some time whether the mitigation you put in place actually worked. That will happen during the performance period. So always check if machines meet national laws, guidelines, and requirements. During the performance, you will do audit to see if machines, now the ones you are taking, they meet national laws, guidelines, and the requirements which are needed. So every day, you are supposed to look at the gaps that you have in these 6 areas in your laboratory. Look at the equipment design, the lab and equipment design. If you're looking at the lab design, it is very broad. How is that lab built? Is it allowing for airflow to happen freely? Are patients getting into contact with the section where analysis of sample is taking place? So if it is happening that patients are getting into contact with samples, then that design of the lab is flawed. And now there's a gap and there's a risk that may occur to you, to the client, and even to the community at large. And if the lab and equipment operation is not operating according to the laws which are provided by the national government, or even with the county government, then that lab operation will put people at risk. Again, if that laboratory is not having a mission and deliverables that it's supposed to be doing. So labs are supposed to be having missions and deliverables. When you're starting your laboratory, What is your mission? What do you want to achieve with that laboratory? Are you going to be doing specialized tests? Are you going to be doing just the basic tests? So if you are not meeting your mission and deliverables, because if you are going to be doing or working with pathogens which are of high risk, then there's a cluster of laboratory that you should be having, and there's a biosafety level that your lab should be having. And if you are registered to be a lab that is performing basic tests, and then you end up doing things which are going to are not basic, are not too basic, and dealing with pathogens which are infectious, then that means that you're already going outside and you're posing risk to people. The lab worker also, if the lab worker does not know about risks, does not know how to assess risks and to mitigate them, then there's a risk there. If the lab worker is not getting continuous training on risk management and biosafety management, there's a problem there. Then laboratory materials like reagents and other consumables, if they're not controlled properly and the reagents are just left everywhere and they are posing a lot of risk to the people, then that is another problem. So when you're doing gap analysis, look at all these 6 things, because if you look at all these 6 things, you will be able to conclude that actually you've done a good gap analysis and you've most certainly covered all the areas in the laboratory which needs to be covered. So, ladies and gentlemen, always remember that biorisk management encompasses biosafety, keeping people safe from the pathogens, and biosecurity, which means keeping pathogens safe from the people. So you can say that biorisk management equals to biosafety plus biosecurity. And then biorisk management system utilizes assessment, mitigation, performance, which is the AMP model, to ensure that safe and secure handling of pathogens. And then a biorisk management system must be designed for compliance with existing legal requirements. A gap analysis can identify, as we said, areas where legal requirements may not be in place. And then finally, legal requirements are not required for biorisk management to be practiced. But as much as legal requirements are not required, you're not obligated to be having legal requirements as a national level, even at the county level, for you to manage risks. You will still be required to manage risk, because if you don't manage them, they will come and haunt you later and haunt you big. Ladies and gentlemen, thank you very much for giving me your time. And that is the end of my presentation. My references were found from the Laboratory Biosafety Manual, 4th edition, which was instituted by the World Health Organization. And some of the things also were found in the Biorisk Management and Biosecurity Guidance. This is also by World Health Organization and was instituted in 2006. Thank you very much, and I take it back to the moderator.
Thank you so much, Ouko. Thank you so much for the beautiful presentation, so elaborate. Kindly let's clap and let's appreciate our presenter today for the work that he's done. We are grateful for enlightening us in that. And yeah, receive the appreciation there, Ouko. Thank you so much. And members, kindly just as I had shared earlier, if you have any questions, just raise them on the chat section, or if you need to speak, you can raise your hand. I will unmute the mic and you will share or ask your question. Thank you. Tara, you're being told the presentation was very nice. That is from Georgiana Akini. Presentation nice and clear from Geoffrey Kwena. A lot of appreciation for your good work, and thank you so much. I've only seen a concern from Francisca Kalondu. Francisca says, if you please will share a risk register template. So I think, Ouko, you can do that through the LMSK, and we can share it on our YouTube channel, so that everyone else or anyone else that will want to have a look at it can have it there and see it. So as I wait for more questions and contributions, I had a question. Maybe I would want to give you these, ask you these, so that as we move along, maybe you tackle this. I'm just concerned because most of our facilities, let me say a large number, are found in resource-constrained areas, and even them getting the finances to facilitate some basic things is an issue. How would you tackle, or how would you advise such facilities that are in resource-constrained areas or setup on setting up safety protocols in their facilities? How would you advise such facilities or managers in such facilities? Back to you.
I think
Oko.
I can take that as we wait for other questions if there are any. So most of the facilities, I'm not saying that mine is exempted. Most facilities lack resources to institute some of these safety procedures, but it is always advised that you begin with what you can do at your level. There are basic things. That is why we had a slide which was talking about the basic requirements for biosafety. There are basic areas where you can begin with. For example, just begin with what is required, like provide PPEs to the workers that are working for you, and also ensure that the things that you can do, like ensuring that you segregate waste. IPC is a big problem. So they are not very expensive, but they are very important. So you can begin with what you can do at your level, what is cheap for you, because sometimes you may not be able to institute engineering controls like having biometrics for people to enter certain areas, or even having a biosafety cabinet can be very expensive for you to have. But if you cannot have those ones, begin with what you can. And then as a lab, because you are a business entity, you're making money, sit down with the management, and then you recognize that there are risks which we are putting ourselves in, we are putting the community in, and even the people who come here so that they can be served. If you have identified that there are risks which are likely going to happen in the lab, and everybody agrees that these risks are going to affect us all, you can begin putting money aside for serious things like having a biosafety cabinet in place, or even having lockable cabinets for reagents, or even having things like, let's say, the guards, which are supposed to be guarding you from fumes, those masks which are supposed to be guarding you from the fumes which are happening in the lab. But if there is not enough money, just begin from the basic level as you go up in place. Because you cannot tell me that you need a biosafety cabinet and you cannot clean a bench. Clean the benches first and ensure that things are arranged properly. Clean the benches and ensure that waste are segregated. What is supposed to go in the red goes in the red, yellow goes in the red, yellow, and then the small things that are required of you, do them first before you go to the bigger things that require resources in the long term. Thank you.
Thank you, Hezron. Thank you for that. Davis Wanjala Wekesa has a comment here. The level, I think he's screenshot part of your presentation, and they quote, the level of safety implemented must be aligned with the level of risk carried. And then he says, not every process requires the same degree of control, but every high-risk process demands a proportionately stronger safeguard. Amazing presentation. That's for you, Oko. He's just appreciating the work that you've done.
Yeah, that is on point. Thank you very much.
You're welcome. So members, I just want to remind us of a few housekeeping things here, even as we go along. We'll want to remind us that our webinars are KMLTTB accredited, and that we'll get 3 CPD points, and that they are usually auto-reported within 24 hours. And we'd like you to pass the message to your colleagues and your friends in the lab sector. Registration, very easy, just using your ID number, your KMLTTB number, your full names, and email address, and you are in. Also, if you miss our presentations, you can always follow them up on our YouTube channel, where we have all the previous presentations set up there. So kindly inform your colleagues, inform your friends and everyone else in this noble profession so that we gather here every day at 3 p.m. and learn and get to refresh and even get to be reminded of things that we've forgotten for the betterment of our profession. So I'd like to take this opportunity to thank each and every one of you for creating time to be here with us to learn and to attend to this webinar. I know you are leaving today with new concepts and with new knowledge on risk management and safety in our laboratories. I would like also to thank LMSK for taking the opportunity to organize and to put together this webinar for us this evening. And most of all, I would like to thank our presenter, Hezron Otera, for taking your time preparing the slides, preparing the webinar and presenting so clearly and so informative. Thank you so much. So members, I would like to take this opportunity even to give Otera these last minutes to give us his closing shot even before we call it a day. Otera, kindly back to you.
Thank you, Nelly. I have very little now to say, but I want each of us to reflect. So think about where you work. And if you could make 3 changes to the biorisk management system at your facility today, what would it be? And how will you do it differently if it has not been done before? Think about that, and then you can begin instituting the most basic things that you can do. And the other technical stuff that requires you to have money or even have facilities put in place, which may be expensive, can be dealt with later, because it is the small things that compound to give us great results later. Thank you.
Thank you, Tera. And members, have a good evening. It was great having you here. My name is Nelly Ogada. See you tomorrow.